Hey everyone, I am here today to give you a short tutorial through a survey for patients who have thyroid nodules and have been treated with a non-surgical treatment option. Now, if you've never had one of these treatment options, please go ahead and stick around for the video because I do give a little bit of a history of myself. And so if you watch this video to the end, you might find that this channel could be helpful to you if you have thyroid nodules and you're looking for a non-surgical treatment option. So here we go. This survey is about thyroid ablation counseling and your satisfaction. This should take less than 5 minutes to complete, and this survey is anonymous. And the results are going to assist in optimizing pre-procedural counseling recommendations for future ablative procedures. I received the link from I'm just going to put other social media for now. I had my ablation procedure performed in North America. I actually was treated at the University of Virginia by Dr. Owen Park. He's no longer there. He's now at the University of Texas Southwestern in Dallas. At the time of my ablation procedure, I resided in a different state to where my procedure was performed because I live in Alabama. So we had to drive about 9 hours by car. I had my thyroid nodule treated with radiofrequency ablation. Now, if you're new to this channel and you don't know what radiofrequency ablation is, head over to saveyourthyroid.org and click at the top of the page, procedures. There's a wealth of information there that explains literally what all of these different procedure options are. Okay, next, my thyroid ablation was performed by a radiologist, specifically an interventional radiologist, and these other two specialties are also often performing these procedures. I have had more than one ablation treatment to my thyroid nodules. Yes, I had a very large thyroid nodule. It was too big to be treated all at once. Part of my thyroid nodule was down here. It was below the collarbone, and you can't ablate something you can't see. And so my doctor had to treat this top part. And then once that was shrinking, it caused everything to shift upward. And so this bottom part could then be treated at that later date. My most recent thyroid nodule treatment was more than 24 months ago. It was actually 5.5 years ago. I was happy with the pre-procedural counseling I received from the clinician performing my ablation. I agree with that wholeheartedly. My doctor was, at the time, he was one of 3 doctors in the country doing it, but he was located at one of the 2 sites offering RFA at that time in 2019. I felt confident in the knowledge and the ability of the clinician performing my ablation. Totally agree. He was fully trained in South Korea and today is one of the world's experts on ablation. I felt that the clinician performing my ablation comprehensively discussed alternative treatments to ablation prior to me deciding to proceed with the thyroid ablation. I don't really feel like this applies because I came to my doctor having already had a surgery consult. I have a really difficult surgical history and I'm not a good surgical candidate. In my case, I wasn't really needing to be educated on the surgical aspects, but that is very important for anyone who's looking into this, that you fully understand what all your treatment options are. So for me, I'm going to just say 3. My proceduralist performed an examination of my voice box before my ablation procedure. At the time of my procedure, I do not remember, so I'm going to say no. But a lot of the physicians that I've talked to in the last year have said they have started doing this camera through the nose option, or some of them use ultrasound and have the patient make a humming noise and you can see the vocal cords vibrating on the ultrasound. I don't remember having to do that. I do remember during my procedure though, my doctor would ask me to speak and verify that my voice was working. I had complications from my procedure? No. If yes, please select which option. Not applicable. The next 2 questions relate to ablation-related voice change, and I did not have a voice change. And for anyone who does have a voice change, that is usually transient. That means temporary. We have in the Save Your Thyroid community seen this happen a very small number of times. However, our patient community has almost 12,000 patients. So it does happen, but it's a very small percentage of the time. Most of the time it can be avoided if the physician is very careful and also screens out patients who have nodules that are too close to vocal cords. Okay, if you experience a change in your voice, which of the following is the duration? So, not applicable for me. The next 5 questions, please reflect on the first decision you made about proceeding with the ablation as a treatment option for your thyroid disease. It was the right decision. Wholeheartedly, I agree strongly that it was the right decision for me. 5.5 years later, my thyroid nodule has shrunk, I believe 90%, and I have no symptoms, and I have my thyroid. So I'm very happy with my decision. I regret the choice that was made. Totally disagree. No regrets whatsoever. I would choose ablation if I had it to do over again. Totally, absolutely. I would even do it again if I had any kind of recurrence of my thyroid nodule or another nodule come up. I would absolutely do a non-surgical procedure like RFA. The choice did me a lot of harm. Totally disagree. The decision was a wise one. Totally agree. Strongly agree. Okay. And that's it. That's the survey. So as you can see, this took very little time. It took longer because I was explaining it as I was going. But as you can see, the questions are here to help doctors learn and understand how they need to counsel their patients. And this is something that we try to provide in the Save Your Thyroid community, is help for patients to understand what the procedure is, how it works, what they should expect, and how they should recover. That we are not doctors. And so we are helping educate doctors with this survey to actually empower them to better help you as a patient as you go through these procedures. So please take a moment to do this survey. Just a few minutes of your time will help so many patients as they go through these procedures to have better outcomes. Thanks so much for listening. Please share this content and help others. If you need resources, testimonials, and support, please join our patient community, Save Your Thyroid. You can also find me on social media and Substack under the media handle, It's Me, Jen Again. Never forget to educate yourself and be your own advocate and save your thyroid.